Parents, listen up. That local doctor that you just heard from, Jeffrey Collins, he says that you really need to pay close attention to your children. Depending on their age, they may not show signs of hepatitis A infection like adults would. Our WPTV News Channel 5's Michelle Casada explains the steps that you can take right now.
It's something to keep in mind as kids join summer camps and play with other children this summer. If they're exposed to hepatitis A, you may not know it.
Pediatric patients we're often a little bit more concerned about. Children less than 6 often won't show very many symptoms, and so we have to watch them closely.
Symptoms for hepatitis A can sometimes be confused as regular flu-like symptoms. If you're not sure, go see a doctor. Chief Medical Officer of MD Now Urgent Care Centers, Dr. Jeffrey Collins, says the best prevention is the vaccine, even if you're not sure if you've received it before.
There's no harm in doing the series again. They can often sometimes check antibodies.
Dr. Collins says if you get tested for antibodies, you can learn if you're already resistant to it. He says if you do get the virus, it will take time, rest, and fluids to recuperate.
Basically, your body will develop immunoglobulins or antibodies to the virus, and so you'll no longer be at risk of catching hepatitis A again.
Dr. Collins says the cost of the hepatitis A vaccine depends on insurance, but usually runs about $60. He says one thing to remember is that the virus can live at room temperature on surfaces for months. That's why using germicidal wipes is recommended. Reporting from the West Palm Beach Health Department, Michelle Casada, WPTV News Channel 5.